Trauma-informed services. So far, we've looked at the causes and the impact of trauma. In this module, we'll start to consider what trauma-informed services look like. First, let's ask why we need a trauma-informed approach in our services. People accessing our services may not recognise the significant effect that trauma has had on their lives, and might not connect their past experiences with their current difficulties. A service that does not incorporate a trauma-informed approach may also fail to make this connection and will struggle to provide effective support. We also need to consider that many of the ways we traditionally offer help to victims of trauma can be triggering for people who have experienced trauma. Despite our best intentions, our actions can reinforce feelings of helplessness and shame, elicit anger and frustration, or bring on survival responses of flight, fight, or freeze. In turn, this can be a barrier for accessing care. Now let's consider a service that is built around trauma-informed care, one which provides compassionate, informed understanding of the client's difficulties, creates safe environments and therapeutic relationships to support recovery, empowers clients to explore the impact of trauma, works to reduce any sense of shame they feel, prevents further impact of the trauma, and delivers outcomes and improved access to support. So what should a trauma-informed approach look like? A program, system, or organisation that is trauma-informed should aim to realise the widespread impact of trauma and understand potential paths for recovery, recognise the signs and symptoms of trauma, not only in our clients, but our staff and anyone involved in the services we provide. Respond by fully integrating knowledge about trauma into policies, procedures and practices. And seek to actively avoid or resist re-traumatisation. Let's look at these elements in a little more detail. Realise. This is about understanding the impact and prevalence of trauma, as well as the potential pathways to recovery. Recognise. From the very first contact with an agency, staff at all levels have to recognise that a client's experiences with trauma can greatly influence how they engage with our services and how responsive they are to programs and interventions. Respond. We need to respond by putting our learning into practice. A trauma-informed organisation integrates knowledge about trauma into its policies, procedures, practices and settings. Resist re-traumatisation. This is all about preventing treatment practices that can trigger memories of the trauma. These reminders might lead our clients to disengage or drop out from care. Trauma-informed care will recognise when any aspects of our services may trigger distress and take steps to minimise any risks. The 4 R's provide a useful guide as to what we should aim to achieve with our services. Trauma-informed care can be built around 5 principles. Safety. Service users who have experienced trauma may have felt threatened in the past. The programme's activities and settings must ensure physical and emotional safety for both service users and staff. Trustworthiness and transparency. Service users may find it difficult to build new relationships. Messages must be clear and consistent to help build a sense of trust. Discuss trauma with sensitivity and listen with empathy. Collaboration must be at the heart of interaction between staff and service users. Involvement from survivor advisory groups, feedback from service users, and survivor partnerships, including staff with lived experience, can all help to shape services appropriately. Empowerment, voice and choice. Treatment and interactions should focus on clients' resilience and strengths, empowering people to take control of their lives and treatment. Cultural, historical and gender issues. Recognizing trauma can be experienced differently by people or communities depending on the social and historical context. Let's explore this final point further. A trauma-informed approach will appreciate social, cultural and historical factors such as sexism, racism, poverty homophobia, and many others. It will also consider the individual needs of the service user, such as their physical ability or their neurodivergence. We also need to consider intersectionality, or the way these factors overlap and influence one another. We can't assume that everyone will understand and react to trauma in the same way. Some cultures will not have a concept that corresponds to trauma, or will recognise the symptoms of PTSD. At the same time, we must be respectful of any existing resources that may exist in different communities. It's important to consider any barriers, physical, psychological, and cultural, to our services. And it's important to provide additional support for those who might be most vulnerable to psychological stress. In this module, we've considered what services with and without a trauma-informed approach might look like. We've explored the characteristics of a trauma-informed service and considered some of the social and cultural factors that might need to be taken into consideration. In the next module, we'll start to consider what a trauma-informed approach looks like at an individual level.